In 2003, the operative technique and initial cases of robotic radical cystectomy were first published. Since then, it's been gaining in popularity versus the open approach. However, the reports on the exact advantages and disadvantages of the robotic approach have been a bit conflicting. So we utilize a New York statewide database to compare the utilization and short-term outcomes between robotic and open radical cystectomy for bladder cancer. So the proportion of robotic patients was about 20% in 2009, rose to almost 30% in 2012. However, the approach-specific surgeon and hospital volume for robotic patients remains significantly lower than for the open patients. When we compared outcomes, robotic was associated with a 40% lower risk of receiving blood transfusion, which is significant just because there's a lot of literature on how receiving blood transfusion at the time of radical cystectomy leads to poor long-term mortality outcomes for patients with bladder cancer. However, none of the other short-term outcomes that we assessed were different between the two approaches. So rates of inpatient complications, length of stay, use of parenteral nutrition, hospital charges, readmissions, and mortality rates up to 3 months after surgery were not significantly different. The learning curve for robotic cystectomy in the literature is about 20 to 30 cases. And given that the majority of surgeons in our study who are doing robotic cystectomy only did 1 to 2 a year, that means it would take almost 15 to 20 years for these surgeons to gain an acceptable amount of competence in this surgery. So we think that it will be interesting to compare the short-term outcomes and modifiable risk or cost determinants again in a few years down the line when hopefully the experience with robotic cystectomy matures on both the surgeon and hospital level, and hopefully there's some centralization of the surgery to more high-volume surgeons and centers.